STIs are out there. But how do you know for sure you're being healthy and safe while you're having fun? The only way to know for sure is by getting tested for sexually transmitted infections. I work in our health department's sexual health clinic. I talk to folks every day, and let me tell you, everyone may not always limit their sexual partners, get tested as often as they should, or they may just lack the access to do so. People don't realize that STIs not only impact their health, but also their partners. Knowledge is power, so let's break down what to know about STI testing. No matter how many partners you have, STI testing is for everyone. Everyone who is sexually active should be getting tested for STIs once a year as part of their routine healthcare. If you have multiple partners within a year, or if you're unsure if your partner has had multiple partners within the year, then you might benefit from getting tested every 3 to 6 months. It's best to get tested and to discuss STI testing and sexual history with a partner before starting a sexual relationship. That way, any infections can be treated before having sex. This prevents any potential spread of infection and the potential to reinfect yourself. So whether it's a fling or a serious thing, get tested and prioritize your health. Untreated STIs can have a big impact on your health. When left untreated, STIs can lead to serious consequences like chronic health conditions and infertility. STI testing is also vital during pregnancy. If you're currently pregnant or are breastfeeding, it's important to get tested for HIV and STIs to prevent passing any infections to your baby. Some people think that they've been tested if they've donated blood or have gotten a recent checkup. But a full screening for STIs usually isn't done unless you specifically ask for it. To get a full screening for STIs, typically a blood and urine sample is collected. If you notice any sores on your mouth, anus, or genitals, you're going to want to tell your healthcare provider because those should be swabbed for testing. Rectal and/or throat swabs are recommended if you're using those body parts for sex. If you have a vulva, a pap smear can detect cervical cell changes that are commonly due to infections. The samples are then sent to a lab. Your healthcare provider will contact you with the results, typically within a few weeks, and let you know any next steps or if you need any treatment. STIs are very common, and many people get at least one STI in their lifetime. Most people who have STIs don't know it because they don't have obvious symptoms. Testing is the only way to know for sure. Take a deep breath and talk with us or your healthcare provider. We can walk you through next steps for your treatment for you and your partner. Testing can actually give you peace of mind. It's the only way to know for sure if you have an STI. It's okay to be nervous, but the more you do it, the easier it gets. To prepare, you could call a trusted friend, family member, or even partner to talk with you about your appointment or even come attend with you. Write down any questions, symptoms, or concerns that you may be having. That way, you don't forget them at your appointment. Testing also gives you the opportunity to talk to your provider about PrEP and DoxyPrep, empowering tools that help protect you against HIV and certain STIs. If you want to learn more about these prevention tools, watch our series, Beyond Just Condoms, on our social media platforms. If you're ready to get answers about your sexual health, call and schedule an appointment with us at the health department. We're here to help.